So welcome everyone to our 2025-2026 workshop series. My name is Audra Cole, and I'm the founder and executive director of Elder Dog Canada. It is my sincere pleasure and honor to introduce today Dr. Faith Banks, who is the founder of the Midtown Mobile Veterinary Hospice Services located in Toronto, Ontario. And I am going to turn it immediately over to Dr. Banks because she is going to introduce herself and then carry on with the workshop on caring for older dogs. So over to you, Faith.
Thank you, and thank you for having me. So quick introduction. I am a veterinarian. I refer to myself as a hospice veterinarian, although if you looked up that specialty, there really isn't one yet in veterinary medicine. But that is really what my focus has been on for the last, over 12 years, I guess now. So I started off, I graduated from the Ontario Veterinary College in Guelph, and I went into general practice in 1996 and did that for about 16 years. And I had a shift, which I'll talk about shortly, but I started Midtown Mobile in 2012. And when I started that service, I wasn't even able to have the word hospice associated with the name of my practice. So even though we were focusing on geriatrics and seniors and end of life for pets, I was still getting phone calls for people calling about, puppy vaccines and spaying their cat and that sort of thing. So I was happy when we were finally able to get the word hospice as part of our name from the College of Veterinarians of Ontario. And then so I started my service in 2012, and then in 2021 I opened an aquamation service, which is, I sort of call it a sister company to our Midtown service. It provides water-based cremation, and I'm not really going to talk about that much. Well, maybe not at all today, but if anyone has any questions, I'm happy to answer any questions you may have. So today we will talk about caring for older dogs. And the purpose of this session is really to, we could spend hours and hours and hours. So it's really just a general overview to understand the aging process and things that you will see and that we see as veterinarians, to recognize some of the common age-related problems that we see, and then ways that we can help support older dogs. So every year I go back to the Ontario Veterinary College in Guelph and speak to the third-year veterinary students. And I always start my lecture with this slide, which talks a little bit about how I got where I am. And I refer to this dog. Her name is Smudge, and she was my firstborn. And I think that this slide is really interesting because it shows sort of the progression of Smudge's life to some degree. So in that first picture, we got her when she was 7 weeks old, and she was just the cutest little bundle when we got her. At 6 years old, she looks like a really healthy, strong, robust female adult Bernese Mountain Dog. And then in the last picture, when she was 13, she looks very, very different from that middle picture. And there are certain things that you can see in that picture that are different, and certain things that you cannot see. So you can probably see that she's a little bit more gray along her face, like her brown eyebrows turned gray. She looks like she's lost weight, and she looks like she has a bit of an anxious look to her in that picture. If it was larger, you would probably see that underneath her are some mats that I had put down all over my house to help with her mobility. And what you also don't see is the fact that she was pooping in the house on a regular basis. In addition to keeping us up at night, panting and pacing around our bed. And so, again, some of these things we can see in our older dogs, and some of them we just we learn that they come and we learn to live with them. But certainly, a lot of the changes that happen in our geriatric pets can be very challenging for the people that are caring for them. But she is the one that really got me interested in learning more about geriatric care and pain management. And it was while I was doing a course on pain management that I read an article that was about animal hospice. And I had never heard that term. So when I looked into it further, I loved the idea of really focusing on geriatric pets and going into people's homes and sitting at their, kitchen table with them or on the couch and really having these longer discussions than we could have in a veterinary clinic about how owners can learn to care for their older dogs. And if or when the time came for saying goodbye, when it comes time to saying goodbye, if it was through euthanasia, I really liked the idea of it being able to be done at home with the whole family around them, and just make it more of a beautiful and less stressful moment for the pet and therefore for the family. So that's sort of how I got to be where I am. So as you know, when our pets, one second, I'm just going to move this up for a second. Oh, one second, things are getting a little funky here. Okay. As you know, when our pets age, they really slow down and they can face a lot of health struggles and they will often need extra support. And this can mean medication, this can mean mobility aids, there are sleepless nights and a lot of adjustments to the routines. But with these challenges, something incredibly special happens, and that is that this bond that we have with our young pup really grows as we help them through this older stage of life. And older dogs will give us so much gentleness and gratitude and wisdom, and they really remind us of the special years that we've shared together. So supporting them through these golden years is not just about meeting the medical needs that they have, which they will have, but really honoring the joy and the comfort and the loyalty that they've given us through their life. This was one of my coworkers' dogs, and he was an older fellow, and you can see he's wearing a belly band because, again, one of the challenges that we can deal with as they age would be house soiling, and so he was just the sweetest thing, but she had her challenges with him. When we talk about a larger dog versus a smaller dog, it's a whole other set of issues as well that people are dealing with, and it can really become a full-time job caring for their pets. And so it's important that we maintain that human-animal bond connection, and so people feel good about helping their pets through these stages of life. So as they age, we tend to talk a lot about quality of life. And there comes a time in a pet's life when we often will have to shift the focus of trying to fix or cure the pet to think more about caring for them. And really, I find one of the difficulties is that veterinarians have a lot of difficulty in knowing when that time has happened, when to shift from curing to caring. And so I don't know how we can expect pet owners to know that if veterinarians still struggle with it as well. And so when I hear that someone has been sent home with the instructions with their old frail pet, that you will know when it's time, or he will give you the look and you'll know. I just think that this is really one of the worst pieces of advice that we can give people. And I often will say that if you feel your pet is giving you the look at the end of their life, that it's quite possible that you have waited a little bit too long here. So being able to assess pets and to understand how they're doing and making the decision to continue to care for them or to choose humane euthanasia is very important. And using a quality of life scale has really proven to be such a helpful tool. And so I'm going to go through that because I think with our older pets, assessing quality of life is so important. And when you think about quality of life, I mean, sometimes it's hard to sort of put that together and really understand what that means, and what factors are truly important. So, when I first started my service, I put together a quality of life scale. And I thought about all the things that were really, really important to assess with a pet. And we would go into the homes, the veterinarians would go into the people's homes, and we would go through this scale, but it was more of a discussion that we would have with the family. When COVID started, we weren't going into the home at that point, for these assessments. And so I spent some time putting it all together in an easy to understand document that we've put on our website that anybody can access. The website is mmvhs.ca. You can download it, you can fill it in. I recommend people print it off and keep it because it really gives you a snapshot of what is happening for your pet at that time. And I have used this quality of life scale, which is my quality of life scale. I've used it on my own pets in the past. And I've had countless people tell me that they have used it as well, in caring and understanding how their pet is doing. And it's really a really, really helpful tool for people. I know that you can't read all of the different categories. So I'll just let you know that there are 14 different categories that people will assess when looking at their pet. And then you'll score your pet from 0, which is very poor, to 5, which is normal or very good. And you will come up with an answer at the end, a number, and that tells you sort of where your pet falls on this quality of life scale. And it's something that you can sort of monitor as things progress with your pet or potentially improve. So when we talk about our older pets, we are thinking about them. We can think about them as senior or geriatric. And obviously, with people, there's a difference, and with pets, there's a difference. So when are they considered senior and when are they considered geriatric? And really, what's the difference? And does it matter? And I think it matters. As far as a senior pet, that's really when we start to think of them as they're starting to slow down a little bit. They have some age-related changes, but generally they're still healthy and able to do the things that they need to do. When we talk about a geriatric pet, that's really in the end, the later stages of their life, and the body starts to show more decline. And we use this term frailty. It's used in people and with pets, that they're more frail, and everything in their life that they are doing is just a little bit more difficult, and we tend to see a little bit of a decline in many sort of aspects of their life. When these changes happen, and of course it's not, one day you're a senior and one day you're a geriatric pet, but we tend to think of different sized dogs hitting these sort of, I'll call it a milestone, at different stages. And so, you've probably seen smaller dogs that are maybe 14 years old and still look great. But if you saw a 14-year-old Newfoundland, they have many more issues than that 14-year-old Chihuahua, for example. So with the smaller dogs, and I'm talking about sort of less than 20 pounds, so the Chihuahuas, the miniature poodles, the Dachshunds, seniors we would call maybe 9 to 10 years old, and geriatric would be 12 years and older. With the medium-sized dogs, which are Cocker Spaniels and the Beagles, seniors would be about 8 to 9 years old, and geriatric would be about 11 to 12. And then with the larger dogs, like the Labrador Retriever, Golden Retriever, boxers, seniors are 7 to 8, geriatric 10 to 11 and more. And then of course we have the giant breeds. And sometimes we'll look at them and feel that at the age of 6, they are a senior, and by 8 or 9, geriatric. So that is a very quick, short progression for these dogs. Now, of course, there are other things that we look at as well, that will help us determine, what sort of stage they're in. But again, it's not a hard, fast rule, but it's sort of a way to think about things. And so if I show you my little Chihuahua that I had, that passed several years ago, this is a great example of some of the changes that happen in our older dogs. Some are sort of meaningful, and some are not as meaningful. But for example, in this picture, I'm showing you what happens to their coat. So she turned gray. You can see the picture on my left. She had quite a bit of brown on her face. And she just sort of had much more graying of that hair. So why does that happen? The cells that are the melanocytes, which are the pigment producing cells, they stop producing melanin. And so the pigment that gives the fur or the hair its color loses that, and it turns sort of that whitish, grayish color. We tend to see this change more around the face and muzzle, and we see it more often in the darker coated dogs. And this begins in their senior years. Doesn't happen to all of them, but it's something that we notice. This dog belonged to one of my colleagues. And in this set of slides, I'm showing you things that happen with a pet's weight. So you can see when he is on the picture on the left, he just looks young and healthy. And then he just looks a little bit scrawnier on the right side. As dogs grow older, their metabolism and body composition change, and they can lose, just like with people, muscle mass. And that's called sarcopenia. They don't absorb nutrients as well. Their appetites will change. They don't smell as well, and so they may not eat as much. There can be hormonal changes, and all of these things, in addition to others, can reduce muscle mass. And so that means not so much in a smaller dog, but in a larger dog, for example, they don't have that same strength in their muscles to get up off a slippery floor. And so we tend to see more mobility changes, which I'll show you in a moment. Am I going too fast or am I okay here? Good? Okay. This dog also belonged to a colleague of mine, and these pictures were taken just 5 months apart. And it's such a big difference. In July, excuse me, she looked thin and her coat wasn't perfect, and she needed to wear a diaper, but she still looked alert and happy and a little bit more robust than she certainly does in the picture just 5 months later. Just again showing decline. This picture is to talk about mobility issues, especially in bigger dogs. I have often had a large dog. I love Bernese Mountain Dogs. So I have a Bernese Mountain Dog, and I love Chihuahuas. And so I have both. And I have often said that my Chihuahua does not need legs. I used to say this with my previous one, but it works now too. I could carry him everywhere, place him down to go to the bathroom, pick him up, carry him up the stairs with me, no problem. But when my Bernese Mountain Dog started having mobility issues, it's a very, very different situation and very challenging for sure for her and for me as her caregiver. So in these pictures, the dog was wearing a harness, which is called a help him up harness, which is my favorite harness that is out there. If you have not seen it or used it for older big dogs, I encourage you to have a look at it online. It's great. Um, but as dogs age, and especially in the larger breeds and the giant breeds, we tend to see more weakness and stiffness and instability. And this is from wear and tear and muscle loss, as I mentioned before, and joint disease and potentially neurological decline. And all of these things make mobility in larger breed dogs a major, major challenge that we see. And often will be the reason that people choose euthanasia for their dogs. Mentally, the pet may be fine, but they just can't care for the pet anymore because they're just too big. And so it becomes a real challenge. And then back to pictures of my smudge, again, showing that sort of anxious look that she developed. And it shows with people telling us that their dogs are a little confused. And so normally they would go to the left door to go outside, and now they're standing in front of the right door, or they're barking more for food at a time when they've just been fed. Quite often, this anxiety and confusion presents itself at night. And this is when people are trying to sleep. And, with Smudge, we had quite a long period of time where she was panting and pacing and walking around our bed and keeping us up at night. And it was really, really challenging for us, knowing that we had to get up the next morning to function. And obviously, it was stressful for her. But the nighttime anxiety is a real big problem with pets, especially the bigger dogs and their owners. So I'm going to talk about, I've put a few pictures of things that we see, but I'm going to talk about some of the major issues that we have with our older pets, not specific diseases per se, but just kind of things in general and ways that we as veterinarians and owners can help. So pain is a sign of something, usually. And it's a real challenging question for people. So, when I ask, do you think your pet is in pain, or do you think your dog is in pain? It's a hard one for people to answer because they are not usually moaning and groaning. They're not they're not vocalizing. They may not be painful to touch them in different areas. And so people struggle with determining, is their pet, is their dog in pain? And so the way that I think about it is that acute pain is easier to identify. So acute pain, your dog gets its foot caught in the door as the door closes. They're going to vocalize, yelp, and they're going to hold up their foot and walk around holding up their foot, and they're going to lick it, and they're not going to want you to touch it. That's acute pain. The issue that we tend to see in our older pets is chronic pain. So this is pain that really does not have a purpose quite often, and has been going on for some time. So this is harder to identify because they're not doing those things that I just described with acute pain. And the way that we can help people, owners, caregivers, determine best if their pet is in pain is by asking questions about their pet's behavior. So it's not even so much from doing a physical exam. So it's not, flexing and extending a leg. It's not touching them in a certain area. It's asking questions like, what did she used to do that she is no longer doing? Is she still jumping on the couch when you sit down to watch TV beside you? Does she still go up and down the stairs? When you take her out for a walk, does she want to go, or are you sort of dragging her? When you come home at the end of the day, and normally she would, get up and stick her head between your legs and, wag her tail, is she doing those things? So is she doing the things that she normally does? And quite often, when people think about it, they realize the answer is no. And so, again, assessing behaviors or changes in behaviors are a really good way to determine if there is pain present. I remember when I first started doing this type of care, and I went and listened to a veterinarian lecture who is sort of the pain guru in veterinary medicine. And she said she thinks about the three P's, PPP, presume pain present. So instead of the pet having to like prove to you that there is pain, say to yourself, okay, I think there's probably pain given that she's a 13-year-old lab. She was crazy in her youth running around. She was a dock diver and she, ran constantly, and there's probably osteoarthritis and issues. Let's try her on some pain medication and see what happens. And so if you think about it that way, then we're going to catch all these pets that actually have pain. Instead of us saying, I'm not sure, maybe there is, maybe there isn't, we'll just continue to watch. Why not try them on some medication, as long as the veterinarian says it's fine, and see if you see a difference? So I remember this so clearly. I had this woman and her dog, and I felt, based on the things that she was telling me, there was pain present in her dog. And she really didn't think that there was, because she felt, I know my dog so well, and I would know. And so I said, let's just try for about a week and see, and let me know. And I got an email back from her with a list of things that she now noticed that were different. So when she walks her dog now, her dog's tail was a little bit higher than it has been in the past. Instead of stopping at the bottom of the stairs before deciding to go up, the dog just would run up the stairs. And there were a whole bunch of other things. They were little things, but they were things that showed her there was pain present, and now she was able to manage it. So this is a great scale. Again, I know you can't really see it. It's called the BEEP pain scale for dogs. There's one for cats, but I'm just showing the dog one. And it shows you different body positions, and then it talks about behaviors as well that you can look at to try and assess where your dog is on this scale to determine if the dog is painful. So it's a very user-friendly scale that's available online. There's also this other one from Colorado State University. It's a chronic pain scale, which again can help you determine if there is potentially pain present in your dog. And so what do we do about it? There are a whole bunch of medications that can be used. Some should not be used. They should all be used under the guidance of your veterinarian. In my practice, we do use Tylenol. I will say that Tylenol is a drug that can kill a cat. And so never, ever, ever, ever give Tylenol to a cat. And again, if this is something that you are thinking about, you absolutely should speak to your veterinarian about it and just make sure that they feel that it is appropriate. Drugs, non-steroidal anti-inflammatory drugs. Many of you have probably heard of Medicam. Gabapentin is another common drug that has been used. Tramadol was a drug that is a little bit more out of favor in the past few years as far as its ability to help with pain. And then some people are turning to cannabis products, Deramax. There are a whole bunch of different things out there. The bottom line is I would just recommend that you speak to your veterinarian and ask them for guidance. I love, when I have a pet that's on pain medication, or any type of medication, I should say, I think about it so much, and therefore I think, did I give it? or was I just thinking that I have to give it? So I make myself a little crazy with it. And so I love a schedule. And so I would make myself a schedule. And in case anyone else in the family was giving medication to the dogs, so I would have their name, I would put the medication, what it was for, and, check it off when it was given. And that just allowed me to sort of take the stress off my brain of, did I give it? Did I not give it? That sort of thing. And then I love, pill containers because it's all ready for me to give. And with my dog, when I was giving Maple her medication, she was terrible to pill. And so the only way I could get the medicine into her was to wrap them in thinly sliced salami. And so, of course, all three of the dogs would need a little piece of salami when Maple got hers. But that's sort of what worked for me. And you need to find a way to make the pilling process less stressful for everyone because it can be challenging. Other things that we see that change with older pets would be their appetite and hydration levels. And so, questions that I will ask the families when we're talking about quality of life. And again, this is one of the categories. We're talking about how they're eating, what they eat, if they've lost weight, gained weight. We will talk about different appetite stimulants that are available. I had one client that had to hand feed, this is her cat, she would have to hand feed each little piece of food to her cat in order to get her cat to eat. By doing this, her cat ate the full amount of food, so it was great. But if she just put it on a bowl or a plate or anything else, the cat would not eat. And so this is how she had to do it. Some pets, again, more cats like to drink out of a faucet, but I suppose drinking out of a hose or, bathtub type of thing would be something the dogs might want to do. But, just figuring out what works and then do it. As far as appetite stimulants, we do have some here in Canada. There's another brand in the United States that is for dogs only called Entice, which is a very good one, but unfortunately we don't have that here yet. Sometimes, sprinkling some treats on their food, liver treats, or, sometimes it's just even opening the fridge and pretending you're cutting a piece of chicken and putting that on their food will get them to eat. So sometimes it's kind of whatever you have to do to get them to eat is what we do. Mobility. I've touched on this already a little bit, but in my practice, it's a big problem. And I've often said that it's interesting because when I worked in general practice, I didn't see these big dogs with mobility issues coming into the clinic. Why? Because it was too difficult. It was too difficult to get them up and into the car and walk down the street, to get into the clinic. And so a lot of these dogs were just sort of declining at home. And having this mobile service allowing us to go into the house, it really changed, how we could help these dogs. And so the things that we talk about, and this is really a big one for sure. We talk about, can the dogs do the things they need to do every day? So we called them ADLs, activities of daily living. Can your dog do their ADLs? Can they get up? Can they get some water? Can they get their food? Can they go outside and go to the bathroom and get to where they want to sleep and rest and be with the family? Those are all important things. And so there are many things that we can do to help these dogs in their house or in and around the house to be able to do their ADLs. And so one of the biggest things I think is the flooring in the house. I've been into many houses that have hardwood floors or sort of stone marbly type of floors. And as lovely as they are, they're terrible for big dogs, big older dogs. They're too slippery. I once went to this woman's house and she had like a shiny marble floor and a tiny little step to get up to just to walk through the house. and her dog would not do it. And she couldn't understand what was happening. And she had a yoga mat, and I put a yoga mat down in that one spot, called the dog over. The dog walked and walked up the one step. So it was all about the slippery floors. And so, I love when I go into someone's house and they say, oh, sorry about the floors, and they're covered in yoga mats, or they're covered in carpet runners, or, Home Depot carpets, or whatever. It makes a huge, huge, huge difference for these dogs. Not towels, not little rugs that are sort of spread apart. Like, you need a runway, so that the dog can get up and fully walk on their runway to where they need to go. Huge difference for them. This is Smudge in her Help 'em Up harness that she wore in her later years. Again, I have no affiliation with them, but it is a wonderful harness. There's a handle that goes between their shoulder blade area, and then there's a handle over sort of their rump area. And you can literally pick them up like a suitcase. So when they are lying down and they need a little help getting up, instead of you shoving your fingers under their bellies, which they don't like, you can just lift from the top, and they wear it all day long. It is comfortable. It doesn't rub or scratch. They don't do that thing that they do when you put booties on them, where they just sort of stand and freeze and don't know how to walk. They really don't mind it at all. And I tell people to put it on in the morning and take it off at night. And it is just a real wonderful tool for families. This was my old house, and again, you can see the carpet runners that I had that are lined on our floor for our dog. They were not for the little Chihuahua, they were for my Bernese Mountain Dog, and they made a massive difference for her. Here are some clients' photos. The cat on the left loved to get onto the owner's bed, and it was quite high, and the cat was a little chunky. And so she had these huge stairs built for the cat, which again, or a dog, to be able to get up on the bed while she was at work, and allow the cat to lie in the place he wanted to lie. Same thing with this little Bedlington Terrier on the right. She loved to look out the window, and she was no longer able to get up on the couch on her own. And so just, simple set of stairs allowed her to do that. Raising food and water bowls, I think, is a really great idea for dogs. I tend to tell people to raise them about elbow height on their front legs. And so that's sort of a good gauge of how high to do it. But it means that they can stand properly without sort of leaning all the way down to the ground. They can just put their head down a little bit. And also you can see there's a yoga mat in front. And so again, it gives them really good grip when they are standing in front of the food and water bowls, so that their legs aren't splaying as they're drinking. So here is a picture of Maple, and you can see that, her leaning over to have a drink was quite simple for her. And really, it would have been better if I had a mat there, but she didn't need it at this point. Ramps to go up and down into a backyard. Some of the ramps that you buy from stores are quite narrow for dogs, and they don't love them. And so Trooper on the left, Trooper's owner had this larger ramp built so he could easily get in and out, down a couple of steps to do what he needed to do. And then again, mats in the house just to allow a bit of a runway. Other products I thought I would just share with you. The one on the top left, they're called Lubani pads. They're little stickers that stick onto dogs' feet. You can also even cut out each of the individual sort of toe pads and stick them on. They are helpful for sure. Not so helpful in the snow, but certainly, in and around your house, if your dog tolerates them, which I think many of them do, they have little grippy things that would just give them a little bit more of a grip. The top right, it's called Paw Friction. You put on like a little bit of glue, and then this sort of like little rubbery almost sandy-like material. Could be a little bit messy. And then toe grips. More people have probably heard of those. And they are these little sort of rubber bands that go around each toenail. So not super, super easy to put on if your dog doesn't like having their feet handled, but they do make a difference in allowing just a little bit of a better grip. So just sharing some different options with you. Again, another ramp and the help them up harness. And this dog they would put a life jacket on Trooper as well, with the harness on as well. And he would just keep it on all day and he'd go swimming. I used to look at people with their strollers and sort of think, oh, it's kind of funny. I didn't totally get it, but I have to say I do now. Um, I know now that people want to still be out with their pets. And if you have a dog that can't keep up with you because they're little or they're old or they have mobility issues, but they love being outside and you love being with them, putting them in a wagon or a harness is really amazing because it means that you get to do the things that you love to do together. And how stimulating and how amazing and how interesting for the dog to not just be stuck at home all the time and they still get to go out with you. So I've definitely changed my tune on that one. The harness up here, that's really just a short-term sort of thing to help the dog. And then this dog on the bottom right had a cart, so the wheels. Not for every dog, but this dog did great with them. Again, being able to take your dogs out, these are all client photos, is just wonderful. Carts and wagons and going jogging. And, this dog, this is a chow chow. Like this was not a small little dog that was going out in a stroller. But he loved being outside and his owner wanted him to still have that cart. So many different ways we can still, keep that human animal bond and keep them stimulated. Um, Elimination and hygiene. This is, again, something that's on the quality of life scale, and it is challenging when you have a dog, especially a big dog, that is having accidents in the house. It is not pleasant. I have always said that it is a little easier to deal with a dog that is defecating in the house because quite often those poops are normal in these older dogs. It's just that due to their mobility and due to loss of muscle and sort of messages getting through properly from one end to the next, they're pooping in the house. It's definitely harder when you have a dog that is peeing in the house and you are not able to manage that. So diapers are a possibility. In male dogs, we use belly bands if they are peeing in the house, which are quite easy to use. These were client photos. And so, it's one thing if there's one mess in one spot, but we've had people that have had to cover their entire apartments in pee pads because it can just be anywhere. And that's really not everybody would deal with that. I am very well aware of that. And this is an example of a belly band. So in a male dog, much easier if they're urinating in the house, just to put a band on them, and most of them tolerate it quite well. That's for a cat. We look at happiness and them doing their favorite things. So, often I will say to people, eating, drinking, and pooping does not make for a good quality of life. There needs to be more in the life of the pet than just eating, drinking, and pooping. And so we want to see if they're happy. Are they still doing things that make them happy? They may not be chasing, balls all through the park, but even if you rolled it to them, can they bring it over or grab it? Or are they still doing things that stimulate their brain and make them happy? Sorry, my printer decided to just go off right now. 1 second. And I thought I would just share this because this is my current Bernese Mountain Dog, and this is what makes her happy, lying on my son like this, and here she is now. So burden on you. This is probably very relevant to all of you in the work that you're doing. And that is, what is the burden that you are dealing with in caring for the older pets? Is it an emotional burden? Is it financial or physical? Obviously, caring for my brother's Newfoundland dog was very different than me caring for my little Chihuahua. And so we have to think about those things as we decide on the care that is needed for the pets. This was the list of medications that a client was giving to her pet when one of my doctors went to her house. She was, a little bit at her wit's end because she felt like all she was doing was thinking about medications, buying the medications, giving the medications. There are 18 different things here that she was doing with her pet, and that was very stressful. And here they are all lined up. At some point, we have to think about with our elderly dogs, are they having more good days or more bad days? And by looking at the quality of life scale, in addition to just thinking about this, which is not an exact science, of course, we can put pennies in a jar or marbles in a jar and think about, what their days are like. But obviously, we want them to have more good days. And when the bad days start to increase, then we need to start having that conversation with your veterinarian. And I'm just about done here. Very quickly, I'll just touch on, when you get to a point where you are thinking about the quality of life of the dog and you are thinking that the bad days are outnumbering, then obviously we have that discussion about euthanasia. It is important to understand what natural death looks like. It's important to understand what euthanasia looks like, and why people would choose one or the other. Generally, I know that for most people, they want natural death to happen. They don't want to be the one making the decision. They want their pet to lie in front of a fireplace, all curled up in a cozy little bed, and have them close their eyes and pass naturally. It doesn't usually happen like that. It certainly can, but it's not. It's not typical that it happens that way. And so many people are therefore choosing euthanasia, which just allows a more calm and controlled process in saying goodbye. It allows us to make sure we have the people that we want present, where we want it, how we want it, any rituals that you want. And so again, just a little bit more of a controlled setting. And just a reminder that, the work that you are doing and the work that we're doing is because of this amazing human-animal bond that people have with their pets and how special they are. And so we have to, at all stages of their life, remember how important that bond is for the families. These are my two babies right now, Putty and Elsie. There are lots of really good websites that you can find information on for caring for older pets, senior pets, geriatric pets, about euthanasia. And then I have my contact information here as well. If any of you are on TikTok, I started posting videos, guess about 3, maybe 4 years ago. I have over 500 videos that I've posted. They're all of me pretty much sitting here or in another room and just talking about diseases in pets, geriatric pets, pet loss, grief, euthanasia, natural death, that sort of thing. I always say I'm don't do any singing and dancing, but it's all just short sort of informational videos that I post that are, a lot of the questions that people have struggled with or think about or worry about. So if you want to dig a little bit further, then by all means, that's a really good place to find information that I've shared. And I think I've just about kept to my time.
Thank you so very much, Faith. I'm sure that everyone present had so many points of resonance, whether, thinking about their own dogs or the dogs that are in our care at Elder Dog, whether that's through our dog care support program or dogs who come into our care to be rehomed, because and we're all about the bond and helping to support that bond. So thank you so much for your wonderful presentation. And I am just going to, in a few, we have some time available. If anyone has a question for or comment for Faith, Karen, you have your hand up. And you're on mute. Everyone's on mute. So there
Hi.
you go.
Thank you so much. That was fabulous.
You're
Uh,
welcome.
I don't know if you have an opinion or if it's even fair to ask you for one on Librela. I know there's quite a controversy going on now about that. And the last I had heard was it's okay if the dog doesn't have any neurological issues.
So I don't know that I have the most up to date. I can say information. I know when it came out, everybody was super, super excited. I used it on two of my dogs as well. Um, um, and then people started noticing issues, and people felt like it was causing a real sharp decline in their dogs. I guess one of the things I think about is that, the population of dogs that we're choosing to put on Librela are often closer to the end of their life as it is. And so would that same progression happen if they weren't on Librela? I don't know. So I guess I don't really have an answer for you. I think it is something that you need to speak to your, individual vet about. I know from, the chat groups that I'm on, some of them still are recommending it and some are saying, I am not recommending it. It's a tricky one because it was really something that everybody was super excited about. And now there's definitely a lot of hesitation about it.
Mm. I think it makes sense, as you say, depending on where they are in their quality of life scale, if it's going to help provide some comfort, because we have had a couple of dogs that we've used Librela on, and it just made the world of difference for them.
Yeah.
They still ended up, did it speed up or slow down the progression? Who knows? As you
Right.
say, it's hard to, I don't know if there's any studies done on that, but thanks for that, for your thoughts there.
You're welcome.
Anyone else? Whitney.
Would you recommend the codeine as a painkiller over tramadol?
So I never used tramadol. From early on, I was told and taught and read that tramadol. What I was told was tramadol is like if you twisted your ankle and you had a glass of wine, you'd feel better, but it's not really addressing the issue. And so that's kind of how I think about tramadol. I've never reached for tramadol. I don't carry it. I've never used it because all the research says it is not helping with pain. So codeine, um, it it's it probably helps more with pain, but it's still not as bioavailable. It's not very bioavailable in dogs. And so again, it's not something that I've needed to reach for in dogs.
What would be
What do
more
I
of
reach
a
for? So
what? Yeah.
again, I say all of this, and it is important that you don't sort of do something to your dog or a dog without speaking to your own veterinarian. But what I have done is I will use gabapentin. I will use Metacam. I will use Tylenol. And sometimes I'll use amantadine. So those tend to be the drugs that I reach for the most.
What was the last one?
Amantadine.
Amantadine. Yeah, just recently, my own veterinarian has put the dog on the tramadol, codeine, and Metacam. 3.
So the three part, as far as 3 individual drugs, the 3 part doesn't scare me, because the 3 part means that each drug theoretically works at a different level in the pain pathway. And so quite often we do reach for more than one drug, because one alone is not going to do the trick. And sometimes by having more than one drug, we can decrease the dosages of individual drugs. So the 3 part I'm good with. It's not what I would use, but if you feel it's helping and that's what your doctor is using, then
Yeah, it's yippee. Yeah, the codeine seems to help more than the tramadol. The Metacam wasn't really touching it. So
right. Well, Metacam alone often won't. It's an important component, but it's not usually going to be enough. And then the other thing I hear from a lot of people about the tramadol is that it just makes them like loopy and weird, and
yes,
people don't like that. And so another reason I don't use it.
thank you.
You're welcome.
Tanya.
I just wanted to say thank you. This is an excellent presentation and a really important one to get into the hands of the people that are actually engaging with our clients and their dogs, because I was talking to one of our volunteers last week, and we have a dog who's almost 18 years old, a lab type. You know, the vet had advised the companion like 9 months ago, you really should put this dog, to sleep. It's time. He's in pain. And I know that our volunteer has become friends with the person, and we don't normally get involved in advice, but she sees this dog in pain. So I don't know. I just think this message is really good to get to all of our volunteers that are boots on the ground, because they're the ones that are seeing this, and it's our clients are struggling, of course, because sometimes that dog is all they have.
Yeah.
And they just like this man just doesn't want to let his Fido go, right?
Yeah.
Because then he has nothing left, and he's much, much older himself and not very healthy himself. So it's just a whole combination of emotions for our clients. But anyway, excellent. Very well done. Thank you for your
Thank you.
appreciate it.
I will often, so one of the things that we do in my service are telemedicine consultations. And we talk, just like this to the family at home. And, quite often I'll have people say to me, like, I just can't imagine coming home and her not being on the couch. And I'll say, okay, listen to what you just said. Like, you're making it all about you. We need to put your dog first. Yes, of course, you're important in this equation. There's no doubt about it. But you have to look at it from their perspective. I've even had people, I've said to them, I want you to write a letter from your dog to you telling you how they feel. Listen to their sort of their voice in a way, or even having the owner, do the quality of life scale, and we'll do it together. And then I'll say, she scored a 47%, like she's failing her quality of life test. Like, what is that telling you? How much worse do you want her to get before making a decision? And sometimes, like, thinking about it that way, they think, wow, no, I don't want her to get worse than she is, because she's already really struggling.
Which maybe would help, some of our clients, because, this man, I don't know if he just doesn't realize, and, like his dog is suffering so badly now. And like, does he really, really see that? Or
No, they
yeah.
don't. It's like when, if you haven't seen someone, your hair looks short
Oh,
from,
up in a
oh, fine. So, if I saw someone today and then I saw them again a year from now, they might say, wow, your hair got so long. And I'd say, really? Like, I didn't really notice because I'm living with it every day. And so when you live with their pets every day and you're used to seeing how they are every day, you don't see the changes. It's only when someone comes over, like a friend or a family, and they come over, and then 2 months later, they come over again and they say, whoa, last time I came over, she barked at me. She came, she sniffed my crotch. She jumped up beside me on the couch and sat with me. And now she's like lying in the corner and she doesn't even notice I'm here. Like when you look at those different times, you see the difference. But for that person, the changes are often really gradual. And so they don't see the difference. That's why taking photos, now and later, or a video now and later, or looking back on videos, like what was my dog doing 3 months ago? Wow, she was running at the park 3 months ago, and now she can't even get up. That's how people see the difference. But otherwise, and love is blind. So they don't see it.
Thank you.
Veronica, did you have your hand up earlier? Oh, you're on mute. You're on mute. You're still on mute. Mm,
My audio. Perfect.
Oh,
Got
there.
There you are.
Thank you. I'll
Okay.
know for next time. Our digest, by the way, I agree, the sentiments from the other ladies that were speaking is beautifully put. Do dogs, when they're older, very often have digestive issues as well? The seniors as they get older, and how would you handle that if it's basically they're feeling pretty good? It's their digestive tract, maybe, I'm wondering about that.
So it's not common that we, put dogs on special medication for that. I would say it's maybe more finding a diet that works a little bit better with their system, but it's not something that I would say like, it's such a common thing for that to
Correct.
happen unless there's an underlying issue.
Correct. Good. Thank you.
You're welcome.
Melanie,
Hi, Faith. Thanks so much. What a great presentation. Just a quick question about activity and exercise. So if a dog is keen to do its favorite things like swimming in the sea in cold water or going for a little run, even though you know they're going to be sore afterwards, is there a time where we should be restricting that activity, or should we just kind of let them call the shots?
I mean, I would say that I would sort of let them call the shots, but if you know that they're really going to pay for it after, then I would try and limit it. Yeah.
Okay.
Because they'll just keep going. I mean, they will, not, there's no thinking about, oh, tomorrow I'm going to be sore. I better not do this. So they'll just go, full speed. So I think it's up to you to say, I know this is really not such a great idea. I think I need to slow it down a little.
Okay, and in terms of long walks, I assume as long as they're ahead of you, or you're not having to pull them along, that they can sort of dictate the length of walk that they want to go
Yeah,
on.
I would sort of think of it the same way. Like if they are the type that will go, and then, that night or the next day they're really paying for it, then I would split it up into a shorter walk.
Okay,
But certainly if they're pulling ahead of you, that's a good sign versus you sort of dragging them from ahead.
for sure. Thanks, Faith.
You're welcome.
Pam, you have your hand up.
Yes, sort of picking up on the food question, and I realize it's very difficult to sort of generalize, but I've heard in some places, definitely like a reduced fat food is often because the activity levels are less and that sort of thing. But I've also heard some reading about protein levels in dog food. The common belief, or the belief was, that as they age, they don't need that high level of protein. But I've been hearing now that like a high protein food is still warranted for senior dogs. And I realize like food discussion could be a whole topic unto itself, but I'm wondering what your sort of viewpoint is, Faith, on specifically maybe protein and fat levels in food for senior and geriatric dogs.
So I know for people, for women, you know, the protein videos on, you know, consuming enough protein have taken over my Instagram algorithm. So it's like all I get now is, you know, making sure I eat enough protein. So I'm assuming it has spilled out over into the dog world. I haven't read anything about that, so I can't comment on that part. As far as the fat part, but I mean, protein is important for muscle synthesis and for maintaining muscles. And so I would believe that that would be an important thing. As far as how much, that I don't know. As far as the fat, yes, I mean the older pets have reduced activity, and certainly fat in their body, not just the fat that they're eating, but once they have more fat on their body, that is pro-inflammatory. So it's not just that we would say, yes, it's harder for them to walk because they're carrying extra weight. The fat on them causes inflammation, and so that is an issue. So having leaner dogs will extend their life. I mean, there was a study that was done years ago with labs, and they free fed one group of labs, and then they restricted another. And I think it was don't quote me, but I feel like it was about a 2-year difference in the lifespan of those dogs. So
Wow. Thank you very much.
you're welcome.
Gary.
Oh,
Oh,
you're
you're on mute, Gary. Mm.
No.
Oh, here.
Yeah.
There we
Okay,
go.
related to the last question. Typically, I imagine in your practice, you see a lot of younger dogs that are overweight. And so I assume that in your case, when you showed us the photos of your dogs, that they had healthy weights. How would one who has a heavier dog, as a younger dog and through much of its life, be able to really ascertain where that point is when the dog starts losing weight and needs different kind of care? Is my question really a helpful one or not?
So are you saying how do you know when they should lose weight, or?
Well, no, it's just, it seems to me like the fact that many dogs are overweight kind of confuses the issue about them losing weight in the end, because perhaps we should have been doing something different about their diet earlier.
Yes.
Yes, earlier. And I'm not sure, it seems to me to be a little confusing, but maybe not.
I guess the key, and I am by no means perfect in this situation, because a friend of mine who's a vet just came over and saw my dog, and she said, "Ooh, she's a little chubby." There are ways to look at your younger dog or older dog and determine what their body condition score is. And so body condition scores are typically out of 9, from 1 to 9, 9 being very, very overweight, obese. And there are photos that you can look at. There are charts. I don't know which group has put them out, but you know, I'm going to say the American Animal Hospital Association, or you know, something like that, or maybe different food companies. But basically, they will show you a photo of what a dog should look like in each of those 1 to 9 categories. And so, you know, you're going from a dog that has like a chest like this to a narrower waist from the side, and then again, you know, has a curve in their waist area from above when you're looking. And when you're looking at this obese dog, they're more like barrel shaped. And so knowing and understanding what those different body condition scores look like and mean, that can help you look at your dog and feel your dog and understand, you know, is my dog truly overweight, or not? Does that answer your question?
Yeah, well, I'm puzzled by my question because I couldn't get it out in a way that sounded really helpful to me or to you. But I do have another question. Let's assume that you do another one of these. Where would you go on the same topic?
Oh, to talk about this, to talk to you?
About caring for older dogs. So,
Oh God, I could talk forever.
yeah, well, that's what you said at the beginning. So,
Yes.
I'm wondering where you would go if you wanted to extend this particular session, because I think clearly from people's responses, they've found what you said to be very helpful. I found it both entertaining and helpful, and also some great analogies that you made to help me understand exactly the point you're making. So, yeah, where would you go from here?
I would talk about the quality of life assessment and how to actually help someone to fill it out and understand it. And, you know, what are the questions that I need answered and for them to understand in order to say, is that a 1 or is that a 5 or is that a 3? So I suppose a quality of life scale, you know, understanding the quality of life scale, I'll call it that. And then, I mean, I talk a lot about what euthanasia looks like. I've talked about anticipatory grief. So, you know, when people start grieving before their pet has actually passed and why it happens and what it means. You know, talking to kids about euthanasia, should other pets be present, you know, everything euthanasia.
Okay. Well, I think then that Audrey should book you for another session.
Oh, dear.
Thank you very much.
You're welcome.
Any final questions? Wonderful. Thank you so much, everyone. And Faith, a world of thanks for your presentation today. As you can see,
Welcome.
yeah, there go the clapping hands ascending.
I'm just looking at the chat to see if there were any questions.
Oh, I thought of something.
Oh, sure.
I thought, yee, got you at the last second. I just realized there's one of my clients, her dog is 12 years old, and he always is very boisterous, but I've noticed recently that he'll be walking along at a good pace, but he may make a misstep, or he may want to burst forth. But I find that he's a couple of times he's actually just collapsed in the front. But other than that, he seems to be very normal. And the client says he's eating well. He's slowed down a little bit. So as a walker, in a case like that, wouldn't one want to curtail the dog's boisterousness? Because to me, there's going to be some sort of an underlying issue or its age. Does that normally, can that happen with older dogs?
I mean, it can, and there could be a whole slew of reasons or nothing really significant. But I would say, you know, maybe just to slow things down a little bit so that he doesn't sort of stumble and hurt himself.
Yes.
But certainly if he still wants to go for these walks and has lots of energy about it, then I would continue with that.
Oh, cool. Good. Thank you. It was fabulous, by the way. Thank you so
Thank you.
very, very much.
You're welcome.
Thank you. All right, with that, I will stop the recording.